The Las Vegas Raiders 2023 #1 overall draft pick Tyree Wilson suffered from a right foot injury on this play. We're going to be breaking down this injury, discussing the timeline, and stay tuned until the end of this video. We've teamed up with Harvard-trained sports surgeon and injury expert Dr. Deepak Chona, who will be giving us a data-driven analysis on when Raider Nation can expect to see Tyree Wilson suited up in the black and silver. Let's get straight into the injury here. We're going to see Wilson at the bottom of the screen rushing from the edge. You'll see the offensive lineman push Tyree to his left, and then you'll see Wilson hop on his non-injured side and go down to the ground and grab that right leg. This angle here, we get a better view of the right foot injury. We see Wilson's body shifted towards the right side as you see him drive towards the quarterback. The next step is where I believe he injured that right foot. It's subtle, but watch him plant that foot as he makes contact with the offensive lineman. And then as he attempts to push off, you notice a slight twisting motion or abduction moment of that midfoot with the toes pointing outward. These type of midfoot injuries are called low energy injuries because you can see just by simply having your foot plantar flexed while pushing the front of the foot into the ground and then performing any twisting, pivoting, or pushing off can direct enough force through that complex to cause it to fail. On the next step, you can see that Wilson knew almost instantaneously that something was wrong as he takes about a half step on that right leg before completely avoiding weight bearing on that side and going down. This injury mechanism is similar to what we saw with Chet Holmgrem and his right foot. As he steps backwards, we could see that the forefoot swings outward as he explodes into plantar flexion. It's that quick little movement of his foot that introduces all of that force through the midfoot. You might also recall Travis Etienne. He came back from a Lisfranc last year, and this was a video that was circling around the internet discussing his mechanics on how he runs. It shows how his right foot abducts outward with each step. This type of running style puts an athlete at a higher risk of developing instability of the midfoot, and this twisting is a common injury mechanism that leads to a Lisfranc in basketball players and football players. Welcome back to the channel, everyone. I'm your host, Dr. Nav. If you guys are learning something new, don't forget to give this a huge thumbs up and please smash that subscribe button. It really helps our family grow. Thank you. As we reviewed previously in our Jimmy Garoppolo video, which has a far more detailed anatomy review if you want to go check it out, the Lisfranc complex connects the midfoot to the forefoot, and this complex helps transfer energy generated by the calf muscle down to the toes during the push-off phase of walking and running. So you can imagine for an explosive pass rusher like Tyree Wilson, it would be damn near impossible to do his job at the level that he does it without this complex fully intact. And without further ado, let's turn it over to Dr. Deepak Chona of Sports Med Analytics.
Tyree Wilson's injury mechanism suggests a Lisfranc fracture and dislocation. His subsequent treatment and timeline together strengthen the likelihood that this was, in fact, a Lisfranc fracture and dislocation. The injury occurred in November of 22. He had surgery that same month, and then 5 months later, he had his implants removed. The most common acute surgical foot injuries for a football player would be the Lisfranc or a Jones fracture, which is a fracture involving the fifth metatarsal on the lateral side of the foot. Jones fractures would generally allow for return within about 12 weeks, as long as there's no complication with healing, although that sometimes can occur and require some extended follow-up. Wilson was unable to participate in the NFL Combine in April, a full 5 months after his injury. Even now, he hasn't fully started practicing yet, although he's reportedly getting close. That timeline would be more consistent with a Lisfranc injury, which averages 10 to 11 months for NFL players. The fact that the implants were removed is also much more common in the Lisfranc situation than it is in the Jones fracture. In the Jones fracture, the optimal construct usually involves putting a screw inside the bone of the fifth metatarsal itself. So it's usually not in a place where it's likely to cause a lot of symptoms and require subsequent removal. Lisfrancs, on the other hand, are commonly treated with a combination of plates and or screws across the joints of the midfoot, and therefore often do require removal after the injury is healed. Looking forward, Wilson has an excellent chance to be ready to play week 1. We do often see decreased production for the first year back, and that likely has to do with quickness deficits because the involved area of the midfoot is important to pushing off. However, Wilson is young, truly elite as an athlete, and was a very high draft pick. And those three factors in our post-injury projection models are tied to relatively favorable outcomes. So overall, our data projects a 2/3 chance Wilson plays week 1, at about 80% explosiveness and rising over the course of the first 8 weeks to about
90%. Also, special shout out to Sanjit from the Las Vegas Raiders Network. He sent us this all 22 tape of the Tyree Wilson injury. We're looking for this video all over the internet. We couldn't find it, so this video wouldn't be possible if it wasn't for Sanjit. Go ahead and check out his YouTube channel. This guy is legit. I've been following him for quite some time. That's it for our video today, guys. If you learned something new, be sure to give this video a huge thumbs up. And for Raider Nation out there, be sure to subscribe to our channel. We're going to be breaking down all, if not most, of the Raiders injuries this year. I'm a diehard Raiders fan, and I'm really looking forward to breaking these down.